Assalamu alaikum everyone. Today we are going to talk about very short but very important topic, that is hypertensive crisis. It is classified into hypertensive emergency or hypertensive urgency. So let's start with the hypertensive emergency. It is defined as if the patient has hypertension of more than 180 by 120, that is systolic blood pressure of more than 180 and diastolic blood pressure of more than 120, along with the end organ acutely damaged. It is called hypertensive emergency. So the organs affected by the severe hypertensions are eyes, CNS, CVS, lungs, and the kidneys. In the eyes, patient may have papillary edema, that is papillary edema, and in the CNS, the patient may develop the stroke because of the hypertension, or along with the stroke, there is encephalopathy and papillary edema. So these are the CNS features, and in the CVS, the patient may have angina, either stable or unstable, or maybe the patient has myocardial infarction that is presented with the complaint of the severe chest pain. And the lungs, due to the heart failure, maybe the patient has pulmonary edema because of the severe hypertension. And in the kidneys, the patient may have hematuria, that is blood into the urine, and proteinuria, along with the proteinuria plus along with acute renal failure. So these are the renal features or the kidney features. So these are the organs involved or damaged by the severe hypertension. This is called hypertensive emergency, that is hypertension along with the end organ damage. So if the patient presented in the emergency department with very severe headache, blurred vision, and altered mentation, then doctor must think about hypertensive emergency. First check the blood pressure of the patient. So if the blood pressure is more than 180 by 120, then you must think about hypertensive emergency and do relevant examination and relevant labs. Now come to its management. The most important drug is labetalol. It is alpha plus beta blocker, and it is most commonly prescribed drug in the emergency department. So the IV infusion of labetalol is very important. And first, reduce the mean arterial pressure of the patient by 25% in minutes to 2 hours with IV agents. So these are various intravenous agents which are used in the hypertensive emergency. The important drug is labetalol, which is alpha plus beta blockers. By the alpha blocking action, it causes vasodilation, and by beta blocking action, it reduces the heart rate. So it reduces the preload as well as reduces the afterload. The dose for the labetalol is 20 mg load IV. So this is the initial dose, then followed by 20 to 80 mg after every 10 minutes. And the other drugs are esmolol, which is beta blocker, trinitroglycerin from the nitrate category, which is venodilator and arteriodilator, and sodium nitroprusside, which is also a vasodilator. So it is important to be remembered that either trinitroglycerin IV or sodium nitroprusside IV should be cautiously used and properly used, because the patient has vasoconstriction of the vessels of the brain due to severe hypertension. If you give the patient suddenly the trinitroglycerin in heavy dose, then it causes sudden vasodilation and there is a vascular compromise occurs. So due to sudden vasodilation, previously vasoconstriction and then sudden vasodilation by these drugs reduces the blood supply to the brain for some times, and it can cause the end organ damage. So these drugs should be cautiously used until the autoregulatory mechanisms become normal. So these includes trinitroglycerin IV and sodium nitroprussides IV. The dose for nitroprusside is 0.252 10 microgram per kg per minute. So this is the dose for sodium nitroprusside, and for trinitroglycerin the dose is 17 to 1000 microgram per minute. The other IV drugs in or the intramuscular drug is hydralazine, which is basically arterial dilator, and nicardipine is calcium channel blocker. All these drugs are basically given IV, not per oral, because of hypertensive emergency. Now come to the hypertensive urgency. It is defined as patient has the blood pressure of more than 180 by 120, that is systolic blood pressure of more than 180 and diastolic pressure of more than 120, but in this case there is no organ damage. And the management is almost similar, but here in this case no IV agents should be given. There is no need to give the IV agents. Reduce the blood pressure in hours using the per oral agents and achieve the normal blood pressure in these patients in 1 to 2 days. So the oral tablets in management of hypertensive urgency includes captopril, which is ACE inhibitor, labetalol in the per oral form, which is alpha plus beta blocker as we have discussed previously, and clonidine, which is alpha 2 blocker on the presynaptic terminal and reduces the norepinephrine levels, hence reduces the blood pressure. And hydralazine oral is reduce, basically it is arterial dilator. And sublingual nitroglycerin can be used in case of hypertensive urgency. So this was whole about the hypertensive crisis. Thank you so much for watching this video.